So thank you so much for being here. I wanted to start off by asking you to please introduce yourself and your role in the Prostate Cancer Foundation of South Africa.
Hi, everybody. Thanks for the opportunity. I'm Andrew Oberholzer, CEO of the Prostate Cancer Foundation. So our Prostate Cancer Foundation kind of includes all the stakeholders involved in prostate cancer. We have a medical and scientific advisory board that involves all the healthcare professionals who diagnose and treat prostate cancer. We have a patient affairs board made up of prostate cancer survivors. Obviously, everything is centered around the patients and getting the best outcomes for them. And then we have a marketing and strategic planning board where our corporate members, predominantly pharmaceutical and medical companies, participate. They provide funding, but they also get involved in the activities of the foundation. So my function as CEO is to coordinate those various boards to make sure they work together. And each of them obviously have their own responsibilities and projects and to coordinate all of the activities of the foundation. I think it's interesting to be able to work with the different role players. So the medical and scientific advisory board obviously come at it from a perspective of diagnosing and treating prostate cancer, and then a lot of healthcare professionals who don't traditionally think about who are involved in helping patients to actually manage the side effects of the treatments. You'll know that sexual side effects are very common even for localized cancer. So for guys who've had surgery or radiation, they battle with the erectile dysfunction. And then the guys who have more advanced or metastatic prostate cancer, obviously we have to remove testosterone. We call that androgen deprivation therapy. And managing those side effects requires a multidisciplinary team, so including your dietitian, your biokineticist, making sure the guys have a balanced exercise program, and of course the sexologist, again, to help those guys reframe sexuality, often because without testosterone, obviously your sexual function changes quite dramatically. And then patients and prostate cancer survivors have a very different perspective because they are on the receiving end of the diagnosis and the treatments. But we put those guys together in a support group, an email support group, and they really do encourage each other and help each other, keep each other motivated through the treatment process.
Sounds lovely.
Yeah, I think it seems like you are doing a wonderful work there. And I think maybe as a follow-up question, you've touched a little bit on that, but maybe you can just elaborate a little bit more with regards to the work that the foundation does. And maybe you can also, I think in the same, just give us some practical examples of the work that you do and how you have helped families like in the that are involved with you in the foundation.
Okay, so one of the biggest challenges we face with prostate cancer in South Africa is that Black guys have a 60% higher risk for the disease. They're also approximately 2.5 times more likely to die from this disease. And unfortunately, awareness levels are very low, particularly in rural communities. In a recent study that was done by the Family Medicine Department at University of Free State together with the Urology Department, 22% of guys who were diagnosed with prostate cancer, only 22% of those men actually had ever even heard of prostate cancer. So if men haven't even heard of this disease, they certainly won't know what the symptoms are, and they definitely won't know of the importance of screening. So I think one of our biggest challenges is just education and awareness, so that men understand that in the early stages of this disease, there usually are no symptoms. And if you wait until there are symptoms, it generally means that the cancer is actually spread outside of the prostate. So we want to make sure that men understand and also have access to prostate cancer screening. And screening nowadays is simple. It's just a PSA, prostate-specific antigen blood test. It's not a cancer-specific test. If a PSA comes back high, it just means there's something wrong in the prostate because the cell wall has been disrupted. So it could be an enlarged prostate, it could be inflammation or an infection of the prostate, and it just does mean that that man will require further investigation. So it's getting that through to men, and then also making sure they know what age they need to be screened from. And we advise Black guys, because they have a tendency to get prostate cancer at a younger age, and also a more aggressive form of prostate cancer. In fact, just interestingly, from a genetic perspective, the tumor burden for Black South African men is even higher than the tumor burden for Black American men. So there are really genetic factors involved, and we're trying now, rolling out research throughout Africa to establish, is that unique to Southern Africa, or is it actually the case throughout Africa? So anyone with a family history of prostate cancer, we want them in, or breast cancer, because the BRCA1 and BRCA2 genes play a role. We want them to be screened from the age of 40, and as I said, all Black guys. And then everyone else, we recommend they consider screening from the age of 45. So that's kind of one of the key messages that we can't try and get across in all interviews, whenever we have an opportunity to speak to men, just to make sure they understand when they should be going for screening and what the screening test involves. The digital rectal examination ideally should still be done, but we know a lot of men have a fear of that. So we're happy if men just go for that PSA blood test. It's sufficient for us to be able to pick up most problems.
Yeah, at the very least, it's a good starting point for a lot of people.
Absolutely. And then in terms of supporting men and their families who are diagnosed with prostate cancer, we do have a helpline. We get a lot of email queries, often not from the man himself. When men are diagnosed with cancer, they go to ground often. They get depressed. They don't want to, they think it's the end of their life. So it'll often be the wife or partner or the daughter who phones, sometimes the son that phones for more information. It can be confusing because there are various treatment options for prostate cancer that's picked up in the early stages, and it's a lot of times it's for men and their families just to understand what those treatment options are, what the disadvantages and advantages of each treatment entails, so that they can make an informed decision. And the unfortunate reality, sometimes doctors will push one particular treatment option and not explain them all thoroughly. And a lot of times then we'll be able to get the man's results and send them through to a medical and scientific advisory board who will provide input on what the different treatment options are available. Sadly, in the state sector, often treatment options are very limited because of resources. It does vary from province to province. So we really want to try and work more closely with the major academic hospitals to try and ensure that there are more treatment options for men diagnosed with localized disease, because we really are far behind many other countries in the world in being able to offer a variety of treatment options. Yeah,
it is unfortunate. You touched on being aware of this risk and doing screening, but for the people that are listening or watching, what are some of the things that men need to be aware of or be concerned about as a risk for prostate cancer? So you've mentioned the family history, and we know from a genetics perspective, family history is obviously a large contributor, but for the average man, what should be a warning sign for them?
So the other two factors are age. As men get older, they're more likely to get prostate cancer. That's why we start screening from 40, but majority of men will be more likely to be diagnosed from sort of the age of 65. And then we've mentioned race as a risk factor as well, unfortunately. So Black guys just really need to be more aware that they are at higher risk for the disease. In terms of symptoms, as I've said, the biggest challenge is that there usually are no symptoms in the early stages. And when men do start experiencing symptoms from when locally advanced disease, when the cancer starts breaking out of the prostate, they will often be urinary system symptoms, because the urethra, the tube that carries urine from the bladder, goes through the prostate and then out of the body, and that tube can be blocked from an enlarged prostate, but also from prostate cancer. So typical urinary symptoms will include men battling to start with urination, but they feel as if they're unable to empty their bladders. They'll have a weak urine stream, painful urination, and then having to get up at night a lot to urinate. But those symptoms overlap very much with a condition that we call benign prostatic hyperplasia. That's an enlarged prostate. So that's why if you are experiencing symptoms, you need to go and get it checked out to ensure that the urologist can make a diagnosis and treat accordingly. So for many who don't know, urologists are kind of like our men's health doctor, the equivalent of a woman's gynae, but obviously also they work with the urinary systems of both men and women. But they are the experts in terms of diagnosing prostate cancer and then initiating the treatments, and then working together with other healthcare professionals, which is something we really are seeing more of, and encouraging that there's a multidisciplinary team approach to even meeting with a prostate cancer patient in the early stages, having an oncologist and a urologist as part of that team, so that they can discuss various treatment options. It works strangely better in state than in private, but it is happening more and more in private practice, and then even bringing other healthcare professionals in along the treatment paradigm. So now we have the need for genetic counselors to be brought in, because it's so much research is showing that genetics plays an important role, and there are new treatment options based on genetic mutations. So we've got the PARP inhibitors coming to South Africa soon. And then nuclear medicine is really playing such an important role in prostate cancer, initially with diagnostics. So we have PSMA PET scanning, which is a much more advanced form of imaging that picks up prostate cancer spreading at a much earlier stage than previous old technologies like bone scans did. And then there are now nuclear medicine treatment options for men with the advanced disease, things like radium-223 and lutetium as well. So it's no longer just urologists that treat prostate cancer. There's a whole team of healthcare professionals involved. And then as I mentioned, all the other allied healthcare professionals that can assist with managing the side effects of treatment.
I think maybe just to go a little bit back, you mentioned the routine screening that men can go for. I just wanted to, for someone who's watching, where do they get the screening? So at a local clinic, do they need to go to a doctor? Where would they access such service?
So if you have medical aid, you can go straight to a pathology laboratory for a PSA test. We recommend for men who do have private healthcare, they should be checking other things regularly as well, like their cholesterol, their glucose once a year, even things like going for a dental checkup. So when they do those annual blood tests, if they are in those at-risk age groups, then we recommend if their GP hasn't recommended a PSA test, just ask a GP to include that PSA test in with all the other bloods. For men who do not have medical aid, it can be a little bit more challenging to access screening facilities, because at present there are no government prostate cancer diagnostic and treatment guidelines. They have been drawn up. They are hopefully going to be implemented within the next year or two, and that will enable men to then go to a primary healthcare facility and request a PSA test. At the moment, they will often turn men away who are not experiencing any symptoms, sadly, which is a challenge, and we're going to have to really do a lot more education with primary healthcare nurses and workers to ensure that they understand prostate cancer a little bit better. We have just launched a CPD website that's got a lot of excellent content for primary healthcare workers. It's completely free, and we hopefully will be rolling that out to ensure it. There's also there are some NPOs who offer free PSA testing. There's a group called the Nova Healthcare Institute that have men's friendly clinics in some provinces and in some areas. Quite active in Gauteng and in Cape Town, that you can walk into any of their centers and they'll do a free PSA test for you. But until we have those guidelines published, it is a challenge, unfortunately, for guys trying to access screening who are not experiencing symptoms in the state sector.
Okay, thank you.
It is a challenge, unfortunately, but I do think we're making strides in the right direction, slowly but surely. I wanted to ask, so there's a lot of people that want to get involved. We've touched on the fact that we're genetic counselors and we have genetic counseling trainees who get involved in support groups, and there's people who just want to volunteer and learn about the work that you do. So how do people go about getting involved, from sort of a financial getting involved to actually volunteering and being part of the foundation?
So financially, donations can be made directly on our website, and we are a registered NGO and a public benefit organization, so we can issue donation tax certificates, which is great. So we appreciate any donations that are made there. And then for people who want to volunteer to help us with running our stand, and we do that at various events. So one of the big events coming up is the Soweto Marathon Expo, where we get the opportunity to talk to thousands of men, literally. So we're always looking for volunteers to assist us with that kind of thing. They can just contact me. My contact details are on the website. We do about a 2-hour training session with volunteers to make sure they understand the basics of prostate cancer. We're not going to make you into a urologist in 2 hours, but we definitely will ensure that you can impart some important basic information. We have a lot of educational material. We have posters on the basics of prostate cancer, which we're happy to distribute free of charge to clinics and to community centers where men can get access to them. We have a lot of different types of pamphlets on different stages of the disease. And again, we're happy to get information out there. There's a lot of information on our website as well, where we cover prostate cancer quite extensively. And then we have a very active Facebook page. So yeah, we're always happy to have volunteers. It's a lot more difficult for us to recruit volunteers than it is for breast cancer organizations to recruit women.
Yes.
And it's just, I think, part of the thing that men generally prefer not to talk about these things. Prostate cancer is quite a personal disease. The prostate is part of an internal man's internal sex organs, and men just generally are not as good as women at supporting each other in terms of their networks. And we actually know that even impacts on life expectancy, that lack of support and not being able to talk to other men who have been on that journey. So that's why we find our email support group seems to work better than face-to-face support groups, because guys are having to discuss very personal things like their erection problems, the urinary incontinence, which they can experience. And they seem to be more comfortable doing that where they're not in a face-to-face kind of an environment. So that works very well also. But happily, just go onto our website, click the contact us, and get in touch and let us know if you want to get involved and what your background is and why you want to get involved. And we're happy to provide the training, and we'll put you to work.
Great. Sounds perfect.
I think from our perspective also, we've just appointed a genetic counselor to our medical and scientific advisory board. The first one, which is great. It's Dr. Chantel Scott from Stellenbosch. And I think we will be doing a lot more, providing a lot more information on genetics and its role in prostate cancer. We'll be doing some video interviews with her at some point, and we'll be putting more information on our website. I think at this stage it's quite innovative. So yeah, even with the medical specialists, it is coming up at all the congresses. But practically, I believe there's not that many genetic counselors in the country, that you are quite scarce. So maybe you can tell us a little bit about that and how people can get hold of them. And I know there's also some challenges with genetic counseling in younger guys, if in terms of their life insurance and in even having their medical aid premiums loaded.
Yeah. So just to kind of touch on that, so we did intend to ask a little bit about genetics, because it's something that is becoming more and more prevalent in the management of cancers. And you mentioned earlier about using multidisciplinary approaches to managing cases, and it's certainly how we are seeing, the treatment and management of patients in our system. Genetic counseling is unfortunately a scarce commodity here in South Africa. There are around 30 of us in the whole country, so not many, but we do have established services in the Western Cape and then in Gauteng as well. The easiest place to find out where you can find a genetic counselor is on the South African Society of Human Genetics website. They have a genetic services directory, and it's basically separated out between state and private, and then by province as well. So you can actually go on there, find the contact details of a genetic counselor and refer someone to a genetic counselor. And a lot of them do teleconsults or remote counseling. And so there is the option of, you know, if you aren't able to meet someone face to face, they can still do a consultation online and facilitate testing wherever they are.
Okay, great. I think that's important information. And as I say, something we need to start talking a lot more about.
Yeah, and Chantal's a lovely addition to the team. She's very passionate about cancer in general, and she's done a lot of work in cancer. So I have no doubt that she will have a lot to add in the sphere of genetics and prostate cancer.
Yeah, excellent. Thanks.
Yes. So I think the question that I have from my side is, so we are obviously genetic counselors and we often deal with patients with prostate cancer. And I think also for just maybe other healthcare professionals who may be watching this. So if you have a patient in front of you diagnosed with prostate cancer, how do we refer them to the foundation? Is there sort of like a referral system in place? And also, is there a fee for these patients, I don't know, like to join the foundation and things like that?
So we don't have a membership for patients. What we do is we invite patients who want to join as volunteers. Just contact us and we put them in touch with the chairman in their particular province, and they can help with those awareness activities. As I said, in terms of queries about the actual prostate cancer, they can we have a helpline, and we all of those are on our website, prostatecancerfoundation.co.za. A lot of they can email a query through as well, and a lot of them will just want different opinions, so we'll send those to our medical and scientific advisory board also. So I think the important thing for patients is to encourage them to make an informed decision. So do there some reading, ask the questions about the side effects of treatments that have been recommended to you, and don't ever be shy to get a second opinion, because you're the one who has to live with the treatment options. And the reality is many prostate cancers, as you know, are diagnosed in the very early stages, and they are the types of prostate cancers that will never go on to progress and become a problem. We call those indolent or clinically insignificant prostate cancers. And those can be monitored without implementing active treatments that will cause side effects. We call that active surveillance. And that is a massive advantage, but a very underutilized treatment option, because patients often don't understand it, and there's a fear and anxiety that they're living with cancer that could suddenly start growing. And we would that's why we would encourage men to do a little bit of reading, check out on our website the different options. Don't make a rushed decision, because the side effects of prostate cancer treatments can be quite life-changing and can really be a struggle for men. Obviously, if the prostate cancer has advanced and has already started spreading, we call that metastatic prostate cancer. We can't cure that type of prostate cancer. We can only slow progression of the disease. And in order to do that, we have to remove testosterone, which is our male hormone. And that has massive implications in quality of life. Just you're going to lose your sex drive, your erections, lose muscle mass, muscle strength, put on weight. So you're more at risk for type 2 diabetes and cardiovascular disease. So again, important for men to be counseled properly about how to manage and deal with those side effects. And patients should not be shy to use other healthcare professionals that specialize. For example, your dietitians can help you with eating advice so you don't put on too much weight. Your biokineticist plays a massive role, because when we think of exercise, we think we must do running or jogging or swimming. That's cardiovascular. But now for men who have had their testosterone taken away, they need to try and maintain muscle mass and muscle strength. So they have to add in resistance training. Taking a man's testosterone away puts them at more risk for decreased bone mineral density and osteoporosis. They have to include impact exercises in their program. So it's not just as simple as saying, yes, exercise and eat properly. We need those healthcare professionals with expertise who can advise them appropriately, as is the case with with genetics. So guys who go on to develop castrate-resistant cancer should be have the option of genetic testing and counseling to check for those mutations, because them, particularly now with a new class of drugs becoming available, they may be able to benefit from those treatment options.
Yeah, like you mentioned with the PARP inhibitors as well. There's,
exactly.
I mean, we will also share some information around hereditary cancer syndromes where prostate cancer is more common. But yeah, look, for the majority of them, they aren't genetic and they still need that multidisciplinary management from different spheres. But the genetics obviously adds a bit more of a complication to the whole story. Andrew, my last question to you was, do you have any, so you said that people get involved and they kind of volunteer to get involved in the foundation. The people that you are supporting through the helplines and through social media, Facebook groups, do you ever host any like meetups or things that people can interact? So you mentioned the marathon where you'll interact with people, but do you have any specific meetups where people can interact with each other or get involved with providing support for one another?
So we do patient webinars as well.
Mm-hmm.
We will intend doing more of those next year, definitely. We'll also be doing a prostate cancer 101 session because we're finding, particularly within our email support group, there's a lot of discussion, and we're just picking up men haven't understood really the basics, and that will be published on our Facebook page. Anyone is welcome to dial into that prostate cancer 101. It can be very confusing for a patient who's newly diagnosed to actually understand the significance, for example, of a PSA test, what their Gleason score actually means. They think that all men who are diagnosed with localized disease are the same, and that's definitely not the case. We take those different measurements and we do risk stratification, and men will often battle with understanding, why is that guy fine and my surgery hasn't worked and the cancer's recurred, and understanding that maybe they had a higher risk type of localized disease, that we stratify. We do patients into low, intermediate, and high risk, even though it's localized prostate cancer. And statistically, those guys with higher risk factors are more likely to experience recurrence further down the line. So we're going to offer that training as well, and that training is also useful for people who are thinking of volunteering, so that they understand the basics. Understanding what PSA testing can and can't do, its limitations, and what it means if your PSA comes back and is high. And then there's so much confusion around things like what causes prostate cancer and what will make the cancer cells grow or stop growing in terms of alternative treatment options, dietary factors, sugar, and with all the information open to people on the web now, people will latch on to things for which there's not necessarily level 1A scientific evidence, and then start spreading that as kind of the gospel of the way to cure your cancer, make sure it doesn't recur. So just getting rid of some of those myths. We're not saying men shouldn't try some of those things, but you need to go in with your eyes open and understand the difference between evidence-based medicine and anecdotal cases where some type of new fancy idea has worked for one man, but not necessarily is going to work for every prostate cancer patient. So all of those things are important, and we want to make sure that information is freely available to people. We'll do webinars with experts in different fields. So there are some on our website at the moment. There's one with a sexologist going through how men can deal with the sexual side effects, the importance of penile rehabilitation for men who go through prostate cancer surgery, so that they understand that needs to be initiated as soon as possible to oxygenate tissue, not for men to wait for a year before they start getting help. And then even reframing sexuality for men for whom sexual function has changed doesn't mean you can't have sexual intimacy. It's just things like reframing. So that we'll do more of those webinars with more experts. We'll do one with a genetic counselor so that we can explain the role of genetics. We'll do one with a nuclear medicine physician so that people can understand also why we're able to pick up cancer spreading at a much earlier stage than before, and what the significance of that is. So I think, yeah, just making sure people have a better understanding of prostate cancer and what their options are in terms of diagnostic methods and treatments.
I think making these services and this information available to people in a far-reaching platform is really, really helpful. And also, I mean, we see it, Barry and I see it all the time in our clinics, this spreading of misinformation, and it actually does a lot of harm for patients, because they'll go to extreme lengths to try and do certain things where we know that that's not necessarily something that's going to be entirely helpful.
Absolutely. Yeah.
Yeah. Barry, do you have any other questions or anything you want to add?
No, I think I don't have any questions. I just wanna, I think I like the idea of the email support group, because I think, as you mentioned, Andrew, these are, I don't know, like deep issues that people may not find very comfortable to share if they came, I don't know, and sat down and like on a face-to-face situation. But probably then sitting behind that email, probably like there's someone out there who probably pour out all their heart and be able to ask all the questions that they have. So I really love that idea, and yeah, it's a really, I think, good resource for patients. So well done on that.
Yeah, thanks. I think also we want to just encourage men to get more involved in their health generally. So there's so many breast cancer campaigns. In September, we run a campaign called Suit Up September, where people buy a little suit up badge for 50 Rand. You can download one on our website for bigger orders. We actually send them out. And people just suit up for one day in September just to help raise awareness about prostate cancer, both men and women. And then in October, we have the Hot Hot Daredevil Run. It's on the 13th of October this year, where men put their purple Speedos on. And it's men and boys, because boys need to be aware of testicular cancer, but it's also creating a health kind of mindset in boys, so that they're thinking about their health from a young age. Last year, we had the biggest number of participants ever, over 4,500 men. So we in Joburg, it's at the Zoo Lake Sports Club. You enroll through Ticket Pro. It's 180 Rand, and includes your Speedo being sent to you. But men can do it wherever they are in the country. So get a group together at your office, at your organization, and just a 5K walk, or it doesn't have to be a run. And it's just a fun way for men to actually get involved in kind of a men's health activity. So those are the two big men's health events of the year, and we encourage men to just get involved in those. It provides a massive platform for us to just talk about prostate cancer as well, and we appreciate all the opportunities for interviews on radio and TV just to get the message out there. So yeah, I think men need to take the lead from women in terms of being more active and involved in their health, and then supporting each other when they are diagnosed with a thing like prostate cancer, and getting involved in educating other men about the disease. I think that can make a massive difference. Great. Thank you very much. And thanks for the opportunity. And we think we'll be working a lot more with genetic counselors in the future. So
that's music to our ears. We're very happy to hear
exciting times.
And I mean, you've really created such a wonderful resource for us to refer our patients to as well. I mean, we've spoken about how this is something that people don't want to necessarily talk about, but as genetic counselors, we're also predominantly female, and so having to keep that in mind, and about having those kinds of conversations with a lot of male patients, it can be really difficult. So, you know, to break down some of those barriers and to go, you know, there is a support group and there's people that are willing to help you and have been in your position. It really, we see it with so many other support groups, but I think this is a really key example of one support group where people can find people who have been through the same situation as them and really find support in that.
Absolutely. Great. Thank you very much for the opportunity, and have a good suit up day.